Greetings everyone, we are the BlackStarDocs and we come together again from our various specialties in medicine to offer you some answers to your questions surrounding the coronavirus.
One unintended consequence of the COVID-19 pandemic has been a global decrease in the amount of people seeking attention for heart attacks and strokes. This has been seen around the world, and rather than being a direct consequence of viral infection, it is thought that people are staying home with stroke and heart attack symptoms because they fear infection with the virus if they seek medical attention. It is extremely important that you seek medical attention if you have symptoms of a heart attack, which can include chest discomfort, pain in your arms, between your shoulder blades, difficulty breathing, feeling cool and clammy, or generally weak. You should also seek medical attention if you have symptoms of stroke. Those can include slurred speech, weakness on one side, numbness, tingling, or even dizziness. The bottom line is if you are feeling significantly unwell, you should seek medical attention. Please do not stay at home. The consequences of that are far, far worse than you going to the hospital and seeking help. Please stay healthy.
Hi everyone, this is Dr. Ellie Gastineau, your board-certified pediatrician. So a way to protect you and your family during this time is by maintaining a healthy, well-balanced diet. We know not only does it promote long-term health and wellness, it also helps our immune system to fight against free radicals and inflammation that may harm our healthy cells and produce illness. So, number one, try and aim for at least 5 fruits and vegetables a day. Number 2, eat your colors. Bold, bright, colorful fruits and vegetables are jam-packed with nutrient-dense antioxidants to help our immune system. Number 3, citrus fruits like tangerines and oranges are jam-packed with the vitamins that will help to aid our immune system as well. And lastly, did you know that a lot of our spices that we use to cook all those yummy Ghanaian dishes do also help to source our immune system? So that's your ginger, that's your garlic, that's your turmeric, and also your red chili peppers. So with that being said, here's to healthy eating. Take care, guys. Bye-bye.
Hello, this is Dr. Erefua Ampedu, your board-certified internal medicine physician. During these unprecedented times, it is important that those with pre-existing conditions, particularly hypertension and diabetes, adhere to management. Unchecked hypertension or diabetes can lead to an inflammatory response by the body, and long-term, this can inhibit the immune system from fighting infections, particularly bacterial and viral, including the coronavirus. So please, make sure you continue to take your high blood pressure medication as well as your diabetes medication, whether they be pills or insulin. If you are having issues adhering to your medication, please see your primary care doctor. Stay safe.
My name is Dr. Bernice Darko Edijemfi. I am an internal medicine physician here in Houston, Texas. The novel coronavirus, or SARS-CoV, just like any other virus, causes our bodies to produce antibodies when we come in contact with them. This is the body's way of fighting or annihilating these pathogens. Patients who have been affected with the coronavirus can be reinfected according to the World Health Organization. Although antibodies are produced, we do not know if they confer actual immunity for us or if they confer immunity, how long this immunity lasts. We don't know if 2 months, 3 months, 4 months, or 12 months down the line, one will be affected with this virus again. Since we do have all these questions still, and we do not have any medication or vaccine to prevent these viruses, it's important that we take the necessary precautions to prevent the transmission. We already know we have to wash our hands. We already know that we have to be careful when we go out in public. But one thing I want to assure you of is if you want to protect yourself and myself, then we should both wear our mask. So wear your mask, share your mask.
Hello, this is Dr. Denise Sefa-Boakye. Greetings from New York City. Today, I'm going to be discussing the benefits of a healthy sex life and why you should work on this whilst you have time during the pandemic. It is a well-established fact that sex is good for your health. Balancing a healthy sex life can be challenging for those who are juggling work life, family life, and other obligations. So for those who are isolated at home now with their partners with a lot more extra time, it presents an opportunity to work on building this aspect of your relationship. Sex is a form of exercise. It can help to strengthen the heart and also lower your blood pressure. It helps to improve your sleep and also helps to relieve stress. Additionally, sex has been shown to ease headaches through the release of endorphins. Finally, for women specifically, sex helps to strengthen the pelvic floor, which has a myriad of health benefits, including enhanced orgasmic quality. So, in closing, we should all remember that having a healthy sex life has lasting mental and physical benefits. So, as you continue to forge new habits, explore hidden talents, and take advantage of the additional personal time this pandemic has afforded us, don't forget your partners. Thank you.
Hi, this is Dr. Tony Cote, and this question comes from Comfort in Texas, and she wants to know, can you kill the coronavirus by inhaling hot steam, drinking very hot tea, or drinking household disinfectants like pine salt, Lysol, bleach, or Dettol? And the answer is no. Not only are those methods ineffective against the coronavirus when introduced into our bodies, but they can also be very harmful. You can end up poisoning yourself or giving yourself serious burns. Don't forget, one of the most effective ways to kill the coronavirus is to wash your hands multiple times a day with soap and water for at least 20 seconds. You can also use an alcohol-based hand sanitizer. Mama ne papa no mesrɛ mo nom enema te sɛ pine salt, Dettol, bleach, and Lysol, and enema bi a de hohoro efie bia. Enu ntimi enku coronavirus no wɔ mu. Na ebetimi aha wo pa. Obetimi ahyehye wo ho, ana betimi poison wo ho. Nti mesrɛ mo sɛ opɛ sɛ ukun coronavirus na kai na hohoro won sa sɛm na ne nsuo bɛyɛ sɛ 20 seconds de bia wontimi ɛhohoro won sa nso a betimi use hand sanitizer ɛno nso betimi aboa ukun coronavirus. Nti me da mo ase for questions see, and we ask that you keep bringing the questions to our inboxes, and thank you. See you next time.
Hello, my name is Dr. Sefa-Boakye, and I'm a board-certified family medicine physician. I'd like to address the question about taking medications that are already in your medicine cabinet that have been maybe prescribed a while ago that you didn't finish taking to prevent the spread or an acute infection of the coronavirus. So actually, no, please do not take any medication that is sitting in your medicine cabinet. And the key word here is virus. This is a virus that at this point in time, there are a lot of clinical trials that we are really investigating to find the correct medication to treat. We're also trying to find the correct vaccine. If you take an antibiotic in your medicine cabinet, unfortunately, it can cause even a worse infection in yourself because what it's doing is it is attacking a bacteria that you might not even have. So the number one thing is don't take medication that is not prescribed to you, number one. And number two, remember what we're dealing with here is a virus and not bacteria. There are some instances that we do use antibiotics to treat viral infections, but it's usually because you catch a bacterial infection on top of the virus infection. But still, that still needs to be prescribed by a medical provider. Thank you very much.
So I recently had a patient send me some photos of his hands and his feet. We jumped on the call and he says, I've had these lesions for about a week or two, but I don't have anything else. I asked him, you know what, do you mind just taking a picture of your abdomen for me? So when I put everything together, he had these pinpoint red spots on his bottom of his feet and as well as his fingers. He also had these faint red lesions on his abdomen. He then disclosed to me that he has been having shortness of breath. He has had some chest tightness. Yep, COVID-19. He subsequently got a nasopharyngeal test through a swab in his nose, which was negative. He said, Dr. Boakye, I think I have fungus of my feet. I said, no. Fungus of your feet doesn't present with shortness of breath, chest tightness, and lesions on your hands, feet, as well as your abdomen. So The key is that we all need to get this blood test. We all need to be tested for COVID via the blood. We will feel more comfortable going out into society if we know we have some immunity to this disease.
Can I breastfeed if I have COVID-19? So breastfeeding has many benefits for both you and the baby. It is not known at this time whether the virus can be passed through the breast milk onto the baby. Therefore, if you are COVID-19 positive, you may want to consider having a healthy person feed your baby. But if that's not possible, then you want to be very careful when you are breastfeeding and having close contact with your baby, which means wearing a mask and washing your hands very thoroughly when you are feeding, whether it's formula or breastfeeding.
Hi, I'm Dr. Ashite, board-certified family physician, checking in with you today. How are you doing? Are you sleeping okay? How are your eating habits? Have you been going to the kitchen way more than usual? In fact, have you picked up that cigarette that you put away months ago? Are you lashing out at friends? How's your diabetes doing? Are you still taking your medications? Or did you stop? Because let's face it, you've got a lot of things to worry about, right? Keeping yourself safe, keeping your family safe, trying not to get this COVID-19. Well, guess what? It sounds like if you're having any of these symptoms, you probably have anxiety, like most of us do. And it's okay. It's not just you. But what are some things that you can do? Because there are some things that you can do. 1, put down your phone. Give social media a break. Give the TV a break. The news is not going anywhere. Schedule something you love. Go for a walk. Get some exercise in. Eat well. Talk to your friends. Call your friends on the phone. Not Facebook. FaceTime. Reach out to your local church group. But if your symptoms are just so severe, reach out to your doctor. Reach out to a health professional. There are people on standby ready to help you. You do not have to go through this alone. We're here to help.